Each year, over $100 billion is spent on health care for bedridden Americans. According to Census Bureau statistics, this number will continue to grow. But the resources available to care for this population are grossly inadequate. Of the 20 fastest-growing industries, nursing homes have the highest rate of occupational injury. Over 18% of all professional caregivers become injured or ill on the job. A shortage of providers aggravates the crisis. After years of research, Acculine International Corporation has developed a breakthrough technology. This patented invention consists of a broad platform for the design and manufacture of a wide variety of specialty beds to be used in hospitals, private homes, and care facilities. A full-size functional prototype of the Uniservice Bed can demonstrate the features of this breakthrough technology. The Uniservice Bed can meet the needs of both bedbound patients and their caregivers while alleviating the extremely high cost of services, the shortage of qualified personnel, and the frequency of on-the-job injuries. Now, take a first-hand look at the truly revolutionary and unprecedented functions of the Uniservice Bed. The Uniservice Bed can change linens while the patient remains in bed without moving or disturbing him. Offer a superior alternative to conventional manipulation through a convenient, familiarly shaped in-bed toilet that does not interfere with the patient. Enable in-bed showering and bathing without requiring movement of the patient. Prevent prolonged pressure on any portion of the body. Potentially treat and prevent bed sores by providing regular relief to pressure points. Assist in the application of therapeutic patient procedures. Enable the X-ray of any part of the body without removing the patient from the bed. Monitor and record the entire patient's body using a camera for concealed areas. Enhance lymphatic return, helping to maintain skin integrity. Provide physical access to the underside of the patient for examination, therapy, or treatment. Here you can see the industrial design plus an animation of the bed's performance. The bed allows for removal of soiled linen and automatic replacement with a clean sheet without any physical effort by the care provider or family member. All while the patient remains comfortably in bed, without movement or disturbance, and without friction between the patient and the linen. The process is bidirectional, and the speed can be adjusted according to medical recommendation. Cycling the bed at a predetermined speed provides a massaging effect, vital for venous stimulation and decreasing embolic predisposition. This feature is extremely important for temporarily or permanently bedridden patients with poor blood circulation and lymphatic return who are prone to develop bed sores. The bed system can create a complete opening under any part of the patient's body to reduce pressure to almost zero and prevent or treat bed sores and wounds or position diagnostic medical equipment. Any portion of the body can be X-rayed without removing the patient from the bed. Here you see the sliding opening in the mattress, which enables free access to any part of the underbody. The care provider can control the size of the opening from 0 to 14 inches under the patient. This gap can be used for placement of a full-sized toilet with a bidet system that enables thorough washing and drying, a much easier and more hygienic alternative to the very uncomfortable bedpan procedure in use today. Patient bathing is another notoriously difficult, time-consuming procedure, posing hazards for the patient and the care provider alike. The Uniservice Bed eliminates these problems in a single stroke by enabling in-bed bathing. In place of the risky and time-consuming bathtub transfer, the bath comes to the patient. The patient remains in her comfort zone while a flexible bath formation unrolls without any disturbance. Then the bath formation inflates along the perimeter of the bed and creates a full-size bathtub with the patient already inside. Now a bath or shower can be administered with the patient's head on the inflatable pillow and both sides of the bed serving as additional guardrails. The cycling stage of the bed even creates an hydraulic massage effect. When the washing is complete, the water is drained and the patient is dried. The bathtub deflates flat and is removed in the same manner as used linen, without moving, turning, or lifting the patient. The market for the Uniservice bed is vast. There are nearly 1 million beds in U.S. hospitals, an additional 2 million home health care patients, and several million primitive institutional beds in the U.S. alone. The worldwide market is upwards of 10 million beds. The Uniservice bed, by treating bedsores and providing a full range of hygienic procedures, can drastically reduce manual labor, saving billions of dollars each year, and substantially improve overall levels of care. We expect the Uniservice bed to be welcomed by the full spectrum of medical institutions specializing in the elderly, and also by those dealing with post-orthopedic surgery care, burns, brain damage, trauma, and combative disorder. The bed is also ideal for rehabilitation centers, skilled nursing facilities, and home care. Nursing care experts estimate that the Uniservice bed will save caregivers 3 to 4 hours per day per patient, representing a potential annual savings of $20,000 per user. This enables the cost of each unit to be recovered in under a single year. Our market research predicts widespread institutional appeal as healthcare organizations and hospitals embrace a groundbreaking device that generates significant savings, improves the quality of life for patients, reduces physical injury to caregivers, and minimizes workers' compensation claims. The Uniservice bed is a revolutionary medical technology long awaited by bedridden people